friends, in the short time I have, I want to share the crux of something which is applicable to most of us. Although there is so much to talk about, and the commonest issue we all face around middle age, is pain, right? I'm sure if I ask you how many of you ever had a low backache, knee pain, neck pain, shoulder pain, there'll be many arms coming up. So instead of losing time in all that, let me just get to the point with the help of some pictures, and then I'll be able to convey my point in a very crisp manner to you. Because somehow we look forward to solutions outside us. We want somebody to do something on us and we become all right. But there's a very big responsibility we have. How are we participating in our own health? What are we doing to make ourselves better? And maybe we are doing certain things unknowingly that are giving us the pain. So my focus today is going to be, highlighting those errors which we are doing unknowingly and are contributing to our pain, and how we can correct them with some quick mantras. And then I'm going to talk to you about the immunity part, because nowadays we all know the scenario. How can we boost our immunity by knowing the potentials of vitamin D? So give me a second to start my presentation. At the same time, mute, please ensure that
प्लीज सब लोग अपने आप को म्यूट कीजिए, क्योंकि कभी कभी होस्ट सबको म्यूट नहीं कर पाते हैं आपके सेटिंग की वजह से।
उनको अनम्यूट करना है। Yes, Dr. Reena, you may. Yeah.
One second. There is some issue occurring. Give me a moment. Is my screen visible?
Yes, it is visible.
Thank you so much. Okay, friends. So the focus, pain-free living and healthy immunity. Well, unfortunately, this is what is the outcome of our today's lifestyle, not just in the form of obesity, but mainly highlighting that we have lost the tone which we are supposed to have. Tone means a state of baseline strength in our muscles. And that's because we are looking for comforts everywhere. Now, look at this lady sitting. We just look for supports and allow our muscles to go on a holiday. No wonder they are losing their baseline strength and tone. So now what are the errors that we are doing unknowingly? Let's begin from our foundation, that is our feet and standing habits. Now, if you look at this first picture, the feet are like a V. And this is a very common attitude in which we stand. This was okay if we were joggers, runners, athletes, cadets in the army, because such activities tighten the muscles of the leg, and this Vishram position would be relaxing to the muscles. But unfortunately, today's time, we are all the time in Vishram anyways. So muscles have become weak. And when we stand with a V feet, we are giving a negative impact to our knee joints. Then the second picture is showing what happens to the knees when the muscles are weak. We tend to push the knees way behind where they are supposed to be. The knees should have been a little more in the front, directly above the ankle joints, finally, but see how the knees have been pushed back. And honestly, we women are very prone to this because we stand for long hours and we lose our muscle strength faster the moment we cross middle age, menopause, or we have thyroid problems, or we have diabetes. The muscles tend to become weaker faster. And this pushing of the knee behind is actually crushing the cartilage inside the knee joint and making it more prone to the wear and tear with day-to-day activities. So we are going to understand how to correct it, because if we do not correct it, this is what that happens. First picture shows the normal space, the joint space between the two bones that make the knee joint. And look here, what's happening when we are pushing the knee way beyond, we call it locking of the knees. So when the knees are locked or pushed back, then the joint space is getting crushed and we are making ourselves more prone to get knee issues. Okay, let's see our second error that happens unknowingly, and that is overarching of the lower back. And it need not be related to just obesity. Even thin people, the arch of the back is much, much more concave than what it is supposed to be. Okay, right? You can see here, she can literally, keep something here, it won't fall. And what does this lead to? The first picture shows a normal curvature of the lower back, and this is the exaggerated curvature. And when the curvature is more, the disc is getting pinched, right? And the pinching is occurring where? At the peak of the curvature. So, lack of tone in the belly is so common. Overarching of the back is so common. Pinching of the disc is equally common. And then in these positions, we get much more backache, especially, for example, if we lie on the belly. Suppose a person with this type of a back is lying on the belly, the disc is going to get pinched even more. Or practices like intense bhujangasanas in yoga, where we lift the chest up, lying on the belly too high. We could be actually doing more harm to the back than good. So, randomly doing yoga in today's time may not be therapeutic. It obviously depends upon a individual's muscle tone and architecture. Now, let's move on to the third common error that we do unknowingly. And as you can see in this picture, the head is racing with the body. It is jutting ahead of the body. Of course, the picture is a cartoon, so it is an over depiction. But this is very common to see our heads leading the body. All right, this is very common where my arrow is. And well, this is because probably we are so hooked on to the computer. Our intellectia is so much powerful that it drives the head ahead of the body, ahead of the spine and the heart. And what happens? Then we get neck pains. So wrong standing habits give us knee pain, wrong curvatures of the lower back give us low back aches, and wrong positioning of the head in relation to the body is one reason for neck pain. Trust me, friends, they are such simple things to be corrected. People are doing the best of exercises, the best of physiotherapy, the best of whatever you can think of, techniques to, come out of the pain. But till we do not correct this basic misalignment in the body, now you see the curvatures of the spine change with posture and attitude. Till we don't correct it, we really do not get permanent answers. And the tips which I'm going to share with you, friends, are very simple. But the best things in life are actually simpler. So let's see them, apply them, and I'm sure you will see a change and you will be able to prevent so many problems for yourself in the future. By God's grace, if there is no problem now, it's equally important to prevent it in the future. So the first mantra or the first tip I would like to suggest is standing on, parallel feet. Okay, you can see the synonym with a railway track. Hmm? The two patries, the two lines of the railway track are parallel. Just imagine if they were not parallel, what would happen? Well, the train would get derailed. So, if we are standing on unparalleled feet, or let us say with those weak feet and weak muscles, we are derailing the joints above the knee, the back, the spine, everything. So, please correct the standing, that is parallel feet. Okay. Next tip. I wish it was a practical ground. I would have really made you all do it and experience some more finis of the practice, but whatever is possible through Zoom, let me share that. Second mantra, which I would like to sort of unlock to you, is unlocking our knees. So in the first picture, which is marked in red to show that, well, this is wrong. The feet are in a V, as you can see, and the knees are pushed beyond. Okay. So they are creating a damage inside the knee joint. So we have to slightly bring our knees forward. You don't have to really bend them, but bring them forward so that they are above your ankle joint. And trust me, it is not difficult to do. It's actually bringing the things in order, you know, in, what should I say, in synchrony with the way it is supposed to be. Theoretically, I'm showing you through slides, and if time permits, maybe I can try to demonstrate it after my slide sharing is over. Okay, friends, now this is very, very important. With this small correction, but applied more often than just once in a day or twice in a day. Once we apply this technique, we have been able to help so many people overcome even surgeries. Even that unlocking of the knees, of course, along with some right exercises, we have been able to help people avoid knee joint replacements. Now, what is this technique for the lower back? Let me make it a mantra. Belly in, tail down. This is the mantra. So let's see it in the picture. The red one is obviously the wrong one, where the belly is not only jutting out, but the tone of the muscles could be less even with thin people. The tone means the state of the look of a muscle, the state of partial strength and contraction is what is called as tone. And well, the overarched back, which is overarched and pinching the discs behind. So in this position, you can apply this mantra, belly in. My arrow is trying to show belly in, tail down. Okay, I repeat, belly in, tail down. If we can bring the tail down, the pinching of the disc will get released. The tail comes down. So you can see it here in the second picture where the hand has been kept in the front and one behind. So belly in, tail down. If I have to simplify this with some similes, you could imagine as if you have to wear a tight pair of jeans, and you have to zip the pant. What would you do? So please note this point because this could be a nice way to understand this very important principle. If we have to wear a pant and zip it, which is really tight, you will do this belly in, tail down to fit into the pant. Okay, it's like toning your muscles in, wearing a belt of your own muscles around so that you never need to use a lumbar belt anytime in life. So zipping the pant would be one simile. I have one more simile for you, which would probably be more interesting. There was a very popular movie called Dabang, okay? And there was a step which Salman Khan does while doing that Dabang, Dabang, he is doing belly in, tail down. So just try to understand this in any way, but apply it. It is going to be of great help to you. Now, in case you cannot understand this belly in, tail down funda, let me give you a couple of alternatives because this is very important. For us women, we have given birth to babies. We lose tone faster than men and we suffer with backache, and this small thing can really help you. So what are the two alternatives? Navel in. Navel means our belly button, nabhi. Just pull it in by about half to 1 inch, and you can do it right now as you listen to me. Okay, and I'm going to make you experience the power of this practice. So friends, just close your eyes, okay? And first relax your belly. ढीला छोड़ दीजिए उसको. आप सीधे बैठे होंगे, किसी चीज का सहारा पीछे ना लें. Don't let your body fall back on the chair or the sofa or whatever. Sit straight, okay? Your belly is relaxing and simply observe your breaths. Now, pull your belly button in by half an inch and let it be there. वहीं रोके रखिए उसको और देखिए आपकी सांस अच्छी हो जाएगी. कोई भी चीज जो हमारी सांस को अच्छा करेगी वो हमको फायदा देती है. ये नॉर्मल है. हाँ, अच्छा, वापस पेट को ढीला कर दें और देखिए सांस को क्या होता है. Your breaths will become shallow. Let's try it again. Pull your navel in by just half an inch and let it be there. You breathe well. So, navel in by half inch should be there all the time. This is how the body is designed to be. Unfortunately, our comfort-driven lifestyles have taken us out of line, out of the muscle tone, and we are suffering. If hamesha nahi, whenever you are reminded, at least pull your belly in by half an inch, and you will bring tone to the muscles which need to get them. Okay? And the second alternative or parallel application would be gently squeeze the muscles of your hip from inside. Not with your hands, huh? ये अंदर की बात है. Just give a gentle squeeze to your hip muscles. Not very tight, obviously, halka sa. This is in yoga called as mool bandh, and it's not supposed to be very tight, by the way. So this mild tone in your hips is another way to activate the weak muscles, which are the cause behind backache. So I hope we pick up something from here. Belly in, tail down, dabang step, or belly in by half inch, or bring a tone in the hips. I'm moving ahead with the fourth error that we do, and that was the head moving ahead. So what is the fourth mantra? I call it head glide. जैसे कबूतर अपना सर आगे पीछे करता है, राइट? उसी प्रकार हम अपने सर को पीछे ग्लाइड करेंगे. So the red box is showing the wrong position of the head in relation to the body, and this is creating tightness in the back of the neck and leading to something called as trapezitis and the pains. But when this smart gentleman glides the head back, glides it back, brings the head neck spine in one line, he actually is relaxing the back of the neck, right? And friends, it's worthwhile trying it even now. So just a few seconds, we'll practice it. वापस से आंखें बंद कर लीजिए. And bring your chins forward, the wrong position. Notice your breaths. Now glide your chin in and see how you start breathing again. The moment the chin gets glided in, your breath starts to move, your brain starts getting more oxygen, more blood, and all the good things starts to happen. Jut your chin forward and see how you lose your breaths. And just imagine if you're sitting like this for hours, what are we doing to our brain? Depriving it of oxygen and the blood. So friends, head glide, chin in and parallel to the floor. This would be the fourth mantra. So let's recap, friends. How we do is more important than what we do. This is the maxim of good health. हम क्या कर रहे हैं उससे कहीं ज्यादा महत्व रखता है हम उस चीज को कैसे कर रहे हैं. So now the 4 tips which I could share in this short time with you: parallel feet, unlocked knees, belly in, tail down, or mild tone in the belly by pulling the navel in, and fourth is the head glide. Even if we can apply these few things, you will experience a better state of health. Just a couple of tips more. When we sit, in case we sit on the floor, sitting on a cushion is a great idea rather than keeping a cushion behind or putting those bumps behind, because in today's time, the backs are already overarched. So placing a bump behind is actually aggravating the problem, friends. So even on your car seats, keep a cushion. Sit on the cushion, sit straight, you will be healthier, whether it is floor or chair. Bending always becomes an issue. We think that bend karne se we get a backache. So in case you have a stiff back or you are a wrong bender, this is wrong bending, where you can see how the back is overarching, knees are pushed back into a lock position and the discs are being prompted to jut out. So safe bending would be bend your knees slightly, and then when you will bend on the hip, it's a folding on the hip, you will not be over bulging or hurting the disc spaces behind. If you want to read more, I could just give you a glimpse. This is my book, Power of Posture, which is available online. There are lots of tips and of course exercises also. And now from here, I move ahead to immunity. Another few minutes to talk about how to strengthen the immunity and introduce you to a global pandemic, which is much before the COVID pandemic. And that is the pandemic of vitamin D deficiency. It's very difficult to accept that we Indians who stay in a sunny tropical country, even here, the vitamin D deficiency is 80 to 90%. Then point number 2, gone are the days where vitamin D was only for the bones. Friends, today we have come to know that vitamin D works on every cell of the body. The way life is not possible without sun, good health is not possible without vitamin D. I get little emotional when I talk about vitamin D because I am one of the, what should I say, I'm treating people with one of the most fasahua, stuck autoimmune diseases by just using a good dose of vitamin D and other friends like magnesium and selenium. And I feel vitamin D is worth worshipping, and we are actually ignoring it. Vitamin D is like a prasad, a chemical gift of sun god to us, and we have actually avoided finding out its benefits. But today we know it can prevent flu, cancer, muscle aches, heart disease, depression, diabetes, autoimmune disease, and the list is too big. Our ancestors never had that many problems because they were farmers. 90% of their vitamin D requirement was met by being exposed to the sun. 90%, huh? And today, we are all indoor personalities, and our sun exposures is also not very healthy. And obviously, there is also one important point to know that diet does not have vitamin D, especially vegetarian food. So, friends, do not confuse calcium with vitamin D. Calcium is present in abundance in food, but not vitamin D. So, today we have landed 2021 at a time where vitamin D is not an optional supplement कि खा लेंगे, देखा जाएगा, नहीं खाया तो कुछ नहीं होता है. No, friends, it is a necessity. It is a cellular necessity. If we either we become farmers, or we take vitamin D supplement, or take medicines later on in life. The choice is ours. So let me come directly to the solution for today's problem. If today we are checking vitamin D levels, we are finding such pathetic blood reports, even less than 10, right? And our ancestors had blood levels of 70 to 80 nanograms per ml. 70 to 80 होता था उनका. और आज के standards में many labs even accept 30 to be normal. Well, friends, it's high time things have to change, and they have changed. The labs are showing that 30 to 100 is normal. 30 to 100 is accepted by the Endocrine Society worldwide to be the normal blood range. So we should not be happy with 30. In case you are, anybody is in the range of 20 to 30, it's not enough to boost your immune functions. For immunity, we need a blood level of 40 to 60. 40 is on the lower side. It would be good to cross 50. 50 to 60 nanogram, not nanomoles. Huh? Some of the labs, especially in Delhi, they measure in nanomoles. Huh? Nanomole का जो value है, you have to divide it by 2.5. 2.5 to come to nanogram. So if somebody has 100 nanomoles, don't be happy. Divide it by 2.5. Your levels are 40 nanogram and not 100. Nanogram is the unit of conversation worldwide. So now, friends, if somebody is not taking any vitamin D supplement for, let us say, more than 6 months, the blood levels that we are finding is this. Okay? And with this level, we can never strengthen the immunity to face the COVID of today or any new strain of virus that may come later on. Okay? So what do? In India, we are lucky to get preparations of vitamin D in strength of 60K. Sachet, tablets, gel caps, there are so many. 60K means 60,000 international units of vitamin D. So to get that immediate boost to immunity, we take it one daily for 3 days if we are in this category. One daily for 3 days, or same 60K, take it twice a week for at least 2 weeks. You can't start with once a week. Huh? It will take ages to reach the level of 40 to 60. 3 months, 4 months maybe, and maybe it doesn't even reach that point. So give a quick boost because we have deteriorated to such low levels. Okay. Let your levels come up to 30, 40 with this, and then maintain it with 60K once a week for at least 2 months. At least 2 months. Then it would be ideal to check your blood levels again and see the results and effects and edit accordingly. Otherwise, a maintenance dose has to go on whole life, always. How much? At least once in 15 days. Taking it once a month is a common practice. This was an old-time recommendation when the focus of vitamin D was just to prevent rickets. Today, for immunity, heart, brain, we want better levels, and we need to take at least, come se come, once in 15 days always. If you stop it, it's like you're waiting your car to come back on the reserve again and then fill the petrol. And I don't think it is worth it. So maintain that level. Vitamin D is a blessing. कि आप 15 दिन में एक बार खाओ तो भी उसका असर रहता है. Hey, you don't have to take it every day. Then comes another category of people who are taking low doses. Like their average intake could be 1,000 to max 5,000 IU. We don't see this in India. We see commonly 1,000 to 2,000 international units daily. It usually are vitamin D preparations along with calcium. Or if somebody is taking once a month 60K, then the average intake is the same, 1,000 to 2,000 IUs daily. And then the average blood levels would be this. So what do? They don't take this 3 days wala dose. It's called as vitamin D hammer dose, by the way, where you take vitamin D daily. And this was used in the West when the swine flu was there to immediately build immunity. So whatever I'm talking to you is scientific with proofs. You can ask me and I can give you so many, you'll get tired reading them. So coming to the second category, these are the people who should take 60K once a week, not once a month or once in 15 days in today's time where COVID is in the air. Take it 60K once a week for 2 months and then go on to the maintenance dose of once in 15 days always. Even if you are going for a vaccination, ensure that your vitamin D levels are good, at least 40. You know why? Because once you take the vaccine, your body has to trigger an immune response against the vaccine. And to do that, it needs vitamin D. The side effects of the vaccine will be lesser, and the immune response to the vaccine would be healthier if the vitamin D levels are kept good. Okay, friends? So that's important for immunity. And just to show you 2 slides, autoimmune diseases are where the immune system is attacking myself. Bell, mujhe maar, like psoriasis, multiple sclerosis, rheumatoid arthritis, lupus, scleroderma. There are so many. 80 of them are there, friends. So see, just 2 slides to share how this person, a patient of mine, suffering from years, and see his situation now just with correcting vitamin D. But at the same time, friends, when I'm treating patients, the dose requirement is not what I have shared with you. The dose requirements are different. They are individualized, they are personalized based on certain other blood tests also. That's my job as a doctor. Another patient of mine, more than 20 years of suffering, and see her picture now. So with this, thank you very much. Thank you for your kind attention and once again the opportunity to share very simple and very, very basic things with you. So I hope I have not crossed the time limit.
No. Not at all. Thank you, Renuji, and that was very helpful. I will be definitely implementing. In fact, while you were talking, I was already implementing all the things that you were telling us,
Thank you.